Tennis superstar and Palm Beach Gardens resident Serena Williams is undergoing treatment for what was a potentially life-threatening condition.
Doctors found a blood clot in her lung this week and had to perform emergency treatment. News Channel 5's Marcy Gonzalez joins us now with more. Marcy?
Well, they found the clot after she returned to L.A. from a doctor's visit in New York. Williams was on the East Coast being treated for a serious cut to her foot. Doctors say long flights are a risk factor for this condition that could slow the star down for a bit.
One of the world's best athletes sidelined by a major medical scare. A spokesperson for Serena Williams says she suffered a pulmonary embolism or a blood clot in her lung. News Channel 5's medical expert Dr. David Serena says it's rare in patients as young as 29-year-old Williams and potentially deadly.
It can be life-threatening because it blocks some of the blood flow that is so necessary in the lung to distribute oxygen throughout the body.
Williams' rep says she underwent treatment at Cedars-Sinai Medical Center in Los Angeles Monday, telling People magazine, quote, doctors are continuing to monitor her situation closely to avoid additional complications.
And now the question, can and will she return to the court?
Williams' former coach Rick Macy now coaches in Boca Raton. He says it'll take more than a medical scare to slow her down.
I wouldn't push the retirement button yet because I think this girl has proved over and over when you count her up, here she is again, and she shows up and wins not only big tournaments or grand slams.
Dr. Serena explains that Williams will likely stay in the hospital for a few days, then be put on blood thinners, something that could impact the star's career, at least in the short run.
Once she recovers from this fully, she should be able to resume her tennis career as she has been all along. However, in the next 6 to 9 months, while she's on a blood thinner, it is risky to get out there on the court. Every fall, every injury can have an increased risk of bleeding and complications from that.
Still no comment or update this evening from the hospital where she's being treated, but we have put information on our website about the warning signs of pulmonary embolisms. You'll find it under this story on the homepage of WPTV.com. Marcy Gonzalez, WPTV News Channel 5.